This is an Aspen Vista Collar in-service training video for healthcare professionals. The information in this video is offered as a guideline on how to apply and check the fit of the Aspen Vista Collar correctly. Collar application should be used in conjunction with the clinical specialist instructions and should only be applied by those who have received the appropriate level of training and are competent to do so. The statements expressed in this film are not intended to be a substitute for professional medical advice. The Vista Collar supports the cervical spine from C1 to C7 dependent on patient condition. Only one size is needed, as the Vista line is fully adjustable to fit the vast majority of patient anatomy. The line provides safe and effective motion restriction for all patients in need for an extended wear product. The Vista eliminates the need for sizing methods of any kind. The innovative design of the Vista allows the practitioner to simply adjust the collar on the patient for a perfect fit every time. The patented design of the Vista disperses pressure, reducing the possibility of skin breakdown. The proven Aspen cotton line pads complete the system by wicking moisture away from the skin. By incorporating 6 sizes into one collar, the Vista accommodates a large range of patient anatomies and eliminates the cost of storing multiple sizes, freeing up valuable storage space. Alternative back panels and replacement pads are available. These are all compatible and interchangeable with the Aspen Vista range. The Vista Collar has front and back sections. The front is adjustable to suit various patient sizes and to ensure a good, comfortable fit. The components are chin pad, chin piece, height indicator holes, extra large access window, adjustable dial, front pad and flexible tabs. The back. The back panel attaches to the front, supporting the back of the head and neck. The collar has a defined top and bottom shape. The components are top occipital cleft, Velcro straps, panel, pad and bottom base of the neck. The Vista Collar fastens both sides with 2 Velcro straps. The front section is shaped to fit under the chin and jawline. The back section sits at the back of the head and at the bottom of the neck. The collar should be fastened firmly enough to ensure a good fit all the way around to limit the amount of movement of the head and neck. The Vista Collar is designed to keep the neck from moving too much and provide support to the neck during the healing process, limiting the amount of motion. When adjusting the collar, this is made simple with having 6 height adjustment settings to easily accommodate a wide range of physical anatomies, allowing for easy adjustments on the patient. Simply pull and turn the height adjustment dial to select one of the 6 height settings. The extra large access window provides functional access for airway management and other essential procedures. It's extremely important to inform the patient clearly about how the collar will help them and also what the fitting process entails. This will reduce both anxiety and fear. Where applicable, you will need to gain patient consent. Check with your medical team the indications, precautions and contraindications prior to application. On removal of the collar from the bag, check that the collar is in good working order. The dial is working, there's no damage, and all the components are present. The collar is packed on its lowest setting with the back panel wrapped around the front panel. The collar can be applied in supine lying or sitting depending on the underlying condition the collar is being used for. In the case of actual or suspected spinal injury, the patient must be fitted with the collar in flat supine position by 2 people. In normal cases, no pillow should be behind the head. The patient should be in spinal alignment with their legs uncrossed and the arms down by their side. There are exceptions to this position. Patients with confirmed or suspected anatomical spinal pathology, such as ankylosing spondylitis, kyphosis deformity, should be positioned to best support their anatomical presentation. To apply the collar in the supine position, follow these 6 simple steps. Separate the collar by removing the Velcro straps on the back panel from the front of the collar and pre-form by bending or rolling the collar ends in towards the centre of the collar. This will help ensure that the collar conforms to the patient's anatomy, making it more comfortable and providing adequate motion restriction. One person stands at the head end of the bed, performing a head hold to maintain a neutral alignment of the cervical spine until the collar has been fully fitted. The second person positions the back panel next to the patient's head between the patient's earlobes and trapezius muscle upper shoulder. The Velcro strap should read Vista the right side up to the person fitting the collar. Place your hand on the back panel and simultaneously press down to compress the bedding and slide the back panel behind the patient's neck until the back panel is positioned correctly. The back panel should be centered behind the patient's neck. The Velcro strap should be pulled out to the sides and aligned at midpoint between the bottom of the patient's earlobe and the top of the trapezius muscle. The patient should also be encouraged not to move their head and to lie still. Pull the side panels apart to open up the collar and then position the collar so that the collar is lying flush under the tip of the patient's chin. The sternal notch should be visible within the access window. Allow the collar to rest, then slide the sides of the collar up and over the trapezius muscle. Then hold the front section of the collar firmly in place with one hand, and with the other hand push the sides of the front panel up over the shoulder muscles and around the neck towards the ears. Whilst holding the front panel with one hand, pull the Velcro straps out and forwards to attach them to the front collar. Ensure that the patient's chin is centered on the chin piece and aligned with the dial and sternal notch. Whilst holding the front panel in place, grasp the dial between your thumb and forefinger and gently pull the dial out to release the lock. Maintain that pull on the dial to turn the dial either clockwise to dial up and raise the front section chin piece of the collar, or anti-clockwise to dial down and lower the front section chin piece of the collar. Dial up until the foam pad on the chin piece begins to compress. This indicates that the correct height has been achieved. Check the green sizing indicator on the side of the front section of the collar to ensure that the collar is aligned in the indicator window. Release the dial and then it will automatically lock. To make sure the collar is locked into place, twist the dial without pulling to confirm it's in the lock position. It is important that the collar is properly sized to provide adequate motion restriction. Ensure there is not a gap between the patient's chin and the chin piece. To tighten the collar, place one hand on the front of the collar and attach the Velcro straps one side at a time with the other hand. To reposition, anchor your fingers on the inside of the collar, form each side panel around the patient's neck by pushing inward on the back edge whilst pulling the Velcro straps out, then forwards to attach to the front panel. This will enable the collar to conform to the patient's neck shape. Make sure that the side does not get caught in the back panel window and that the front and back panels overlap each other, as this can prevent a good fit from being achieved. Tighten the other side equally and repeat as needed to ensure a snug, symmetrical fit. On visual examination, the collar should be checked from a front and side view. The chin should be centered comfortably on the chin piece. Their nose and chin should be aligned vertically through the center of the collar at the front. The head should be in neutral alignment, not overextended. Sides of the back piece should overlap sides of the front piece. The Velcro strap should be aligned symmetrically so that each side is the same. Sternal notch is visible, and both the front and back panels are central. Chin, dial and sternal notch are all in alignment. The large openings in the front piece and the back piece should be centered over the neck. The collar should be flush with the skin. There should be no slack or gaps in the collar. To check this, push your finger down past the ear behind the mandible. Run your finger along the collar towards the chin and then underneath the sternal aspect of the collar. The chin should be flush with the end, and the chin pad should sit under the chin, not sticking out. No plastic parts of the collar ought to be in contact with the skin. Check the back of the chin piece is not pressing against the patient's throat and that they can breathe and swallow comfortably. With a patient in supine position, position the back panel behind the patient. Preform the front panel of the collar and position it under the patient's chin. Dial the height of the collar until the patient's chin compresses on the chin pad. Attach and tighten the Velcro on each side of the collar. Pivot each side of the collar off the trapezius to support the chin and achieve a proper fit. Check the airway is clear and that the patient can swallow. Check no plastic is touching the patient's skin and that no hair is in the collar, and ensure the collar is a snug fit. To apply the collar in the upright position, follow these 6 simple steps. Preform by bending or rolling the collar ends in towards the centre of the collar. This will help ensure that the collar conforms to the patient's anatomy, making it more comfortable and providing adequate motion restriction. Inform the patient to sit up straight, keep their head still and in neutral alignment with their shoulders relaxed. While pulling the side panels apart, position the collar under the patient's chin in contact with the sternum, with the side panels up and over the trapezius muscles. The sternal notch should be visible within the access window. At this point in the fitting process, it's okay if the patient's chin is not touching the chin piece. Ensure that the patient's chin is centered on the chin piece and aligned with the sternal notch. Loosely attach back panel Velcro straps to white or grey areas to maintain front panel placement during sizing. Do not attach Velcro straps to the green area, since this may interfere with the height adjustment of the front panel. Pull the dial out and turn clockwise to raise the chin piece. When the chin piece is supporting the chin, release the height adjustment dial and it will self-lock. To confirm the dial is locked, twist the dial without pulling. It's important that the collar is properly sized to provide adequate motion restriction. Ensure there is not a gap between the patient's chin and the chin piece. Ensure that the dot is completely within the sizing indicator. To tighten, anchor your fingers in on the front of the collar and peel back the strap on each side. Tighten and reattach, or keeping your thumb hooked into the opening at the front, you can then tighten the Velcro one side at a time. Form each side panel around the patient's neck by pushing inward on the back edge, whilst pulling the Velcro strap out, then forwards to attach to the front panel. This will enable the collar to conform to the patient's neck shape. Please make sure that the sides do not get caught in the back panel windows and that the front and back panels overlap each other, as this can prevent a good fit from being achieved. Check to see that the back of the chin piece is not pressing inward onto the throat and that they can breathe and swallow comfortably. If it is pressing inwards, you may need to readjust the position of the collar by lifting and angling the back ends of the side panels up towards the ear. To complete the application of the collar, ensure that the back panel is kept central and tighten each side equally until a secure fit has been achieved enough to provide adequate motion restriction. On visual examination, the collar should be checked from a front view and a side view. The chin should be centered comfortably in the chin piece. Their nose and chin should be aligned vertically through the center of the collar at the front. The head should be in neutral alignment and not overextended. Sides of the back piece should overlap sides of the front piece. The Velcro strap should be aligned symmetrically so that each side is the same. Sternal notch is visible and both the front and back panels are central. Chin, dial and sternal notch are all in alignment. The large openings in the front piece and back piece should be centered over the neck. The chin should be flush with the end, and the chin pad should sit under the chin, not sticking out. The collar should be flush with the skin. There should be no slack or gaps in the collar. To check this, push your finger down past the ear behind the mandible. Run your finger along the collar towards the chin, then underneath the sternal aspect of the collar. The sternal notch should be visible within the access window. Run your fingers along the back of the head, along the top of the collar, and then under the bottom section of the collar. With the patient in an upright position, preform the front panel of the collar and position it under the patient's chin. Position the back panel behind the patient and dial the height of the collar until the patient's chin compresses on the chin pad. Attach and tighten the Velcro on each side of the collar. Pivot each side of the collar off the trapezius to support the chin and achieve a proper fit. Check the airway is clear and that the patient can swallow. Check no plastic is touching the patient's skin and that no hair is in the collar, and ensure the collar is a snug fit. There are pads for the front panel, chin piece and back panel. The Vista pads can be removed when soiled and changed for a new clean set. To replace and adjust the pads, the grey-green colour material grips the Velcro dots. The pads must cover all edges of the plastic to avoid touching the skin. To remove the pads from the front panel of the collar, lift off from the Velcro dots. To reattach the pads on the front of the collar, properly align the bottom larger pad with the corresponding Velcro dots and the plastic circle component of the collar. For the upper pad, ensure that the top piece covers the front and rear edges of the plastic components and attach to the Velcro dot on the chin piece. To remove the pad on the back panel, unthread the straps on each side and then pull the pad off the back panel. To replace the back pad, begin by attaching the grey-green sides of the pad to the Velcro dots on the back panel. Once the padding is aligned with the plastic, the straps will then need to be re-threaded through the padding and plastic slots. The plastic components can be cleaned with either mild soap and water or a disinfectant wipe. Ensure it is dry before the pads are reattached. The pads can be hand washed with mild soapy water, then lie flat to air dry. Remove the collar at least once per shift. A head hold should be performed on patients that are bedbound with unstable cervical spine injury. Any device in close contact with the patient's skin can increase the risk of pressure damage to the skin. This is caused by an increase in skin temperature and excess skin perspiration. In patients with moist skin, skin breakdown is increased fourfold compared to those with dry skin. To prevent pressure ulcers, the following precautions need to be taken. Keep the skin clean, dry and cool. Remove the collar, inspect the skin at least once per shift, particularly at the bony prominences. The usual pressure points are chin, collarbone, throat, sternum, earlobes and the back of the head. Check for signs of skin breakdown and palpate for skin changes, including within the hairline. Maintain hygiene under the collar, clean the skin under the collar daily. Wash with warm, soapy water and dry thoroughly. Do not apply powder or lotions. Change the pads if they become wet or soiled. Make sure long hair is moved out of the way and that there is no jewellery, other objects or debris in between the patient's skin and the collar. If you have any concerns regarding the fit of the collar, please escalate to your local specialist team for review and appropriate management.